Welcome everyone. My name is Dr. Eckert. I'm the CEO and founder of Hormonify, and I'm sure you've seen my other videos, and today I'm honored to have our psychotherapist team member, Dr. Richard Siegel. We're going to discuss a little bit about what he does for our patients, and I'm very excited to have him here. Dr. Siegel is a PhD psychotherapist for over 40 years, and he has been seeing patients of our We've seen our patient for about 25 years. He specializes in post-traumatic stress disorder and other stress-related disorders, as well as anxiety, depression, and addictive problems. His specialty is considering patients' anxiety depression that is a secondary result of a history of either childhood or early life trauma. So, Dr. Siegel, welcome.
Thank you for having me.
So, Dr. Siegel, what is it that you do when we refer a patient to you for your therapy?
When someone comes to see me, the first thing I do is an intake where I review their history. And after we review the history, I look for points of trauma, abuse, neglect, or loss that has caused someone to actually freeze in time. An example being a gentleman came to see me who was in a plane, took a nosedive, everyone's screaming, and the result is he has post-traumatic stress. Pilot obviously pulled the plane up. I'm speaking to the patient, but I said to him, let me ask you a very, very, very odd question. Did you live through that plane ride? And he said, no, not really. Now, why did he say that? He knew he was alive, but the way I asked it, I was tapping into that part that was frozen in that plane that didn't want to go into the next moment. It's called dissociation. And when we go through something that we can't deal with, it's too overwhelming, we tend to dissociate to not be there for the next awful moment. So when I said to him, did you live through that? He was speaking from that space of where he was frozen in time to avoid the next moment, which held certain death. So that's what happens to us as we grow up and we don't have the boundaries that we have as adults, where things can get in more easily or we can lose ourselves more easily because we don't have those firm boundaries. So what I do is I find out where the damage was done, because again, the damage was done on, I'll say it this way, the damage was done on a subconscious level. The gentleman in the plane didn't say, gee, this is the worst moment of my life, I think I'll freeze time right about now, but that's exactly what his psyche did in about 1/10 of a second. So what we want to do is we want to go to that subconscious level where the damage was done and heal it or fix it at that point. And so the way it works is we find that part that's frozen in time and move it forward so that it's no longer frozen there. For example, someone who's been in a bad car accident, for years they have flashbacks. Why? Because they were frozen and they're still there.
Does that dissociation cause anxiety?
Oh my, it's the basis of anxiety.
Isn't it trying to protect the individual from either emotional or a psychological pain?
Exactly, very exactly. And we can use those symptoms to resolve the issue, to resolve the problem.
So wouldn't you say that this is a protective mechanism that's gone awry?
Very much, that's exactly what it is.
So there's nothing really inherently wrong with someone who is anxious necessarily, except for what you mentioned. There's nothing wrong with having depression or anxiety. But really what is wrong is that since it's unresolvable, since it's buried in the subconscious, a patient usually cannot do that on their own unless they have done it by the time they see me.
It's hard to be, if not impossible, to be in your subconscious mind and your conscious mind at the same time. However, that's what I do. I facilitate that journey into the psyche, into the subconscious, to find out where the damage was done, find out where the part of self froze in time, move it forward and out of there. Because, you know, the difference between what I do and a lot of therapists and psychologists do is I look at the time where the split occurred and take that part of the self and move it through. And what that does is it restores that part of the self that was frozen.
I have noticed many times when patients come to us for hormone therapy that there is a component of anxiety, depression that is made worse with hormone deficiency, but is inherently before a woman goes through the menopause or a man shows signs of testosterone deficiency. So I've seen that, and I have a name for it. I call it the original trauma. It's not the same, but isn't finding the original trauma sometimes very helpful in terms of seeing a repetitive pattern on how people deal with other traumas later in their life?
Absolutely. What you might identify as the trauma that caused the current problem, that may or may not be true. The subconscious mind has the ability to heal itself, given the opportunity. And using the subconscious mind, it will direct us to the place where the wounding occurred. A metaphor is the language of the subconscious mind. An example would be a computer. I could take 5 years trying to fix my computer and take another 5 and not do it. A programmer comes by, he goes like this, fixed. Why? Why could he fix it in minutes what I could never do? Because he knows the language of the machine, which is an operational machine language, which is binary. We have an operational machine language too. It's not binary, it's pictures. And that's what we operate on. For example, if we're walking down the street, and a big dog comes up to us and you go to pet it and I back off, you felt safe, I didn't. Why? Here's how the mind works. The left logical brain looks at the right visual brain, sees something, and then the left side has a thought or a feeling to which you immediately react. That took 1/10 of a second. So you're not conscious of what you're unconsciously seeing, but you know how it makes you feel.
So, with your extensive experience, how helpful is it that you can find by conversation the original trauma, the trauma that really caused the dissociation?
It's critically important because what we call the wounded child within, that part of the self that froze in time due to trauma or abuse or neglect or loss, that wounded child within actually has custody of the adult's physiology, of the way they think, the way they feel, the way they react. And so what we feel, the pain, the emotional pain that we feel really belongs to that part of self that's frozen in time. And we can, and where is he frozen in time? In the subconscious mind. And so having access to the subconscious mind, we allow it to bring us to the times of wounding, which it will on its own. And by observing it, just simply observing the subconscious mind, it can repair itself just by being watched.
So, in our experience at Hormonify, we found that when we had a new patient, we have patients from all over the country, all over the world. And the assessment by our medical team is to determine what of the symptoms of anxiety, depression, insomnia, mood changes, irritability are from hormone deficiencies, and what predate or one that is made worse by the hormone issues that presented to us at Hormonify. So after doing this for 20, 25 years, it was determined by me, because I'm not a therapist, that the best person to do that would be a trained therapist like Dr. Siegel. And it's been very successful. I've had patients come back, we take care of the hormone issues, and they go see Dr. Siegel very quickly, find the source of the original trauma, the stress, the anxiety goes away, and the therapy helps them dealing with all the issues that they have to deal with. And it is a great combination. It's unique. I don't think anyone else in the country has done this, but the union of two specialties have really benefited our patients immensely. So I just want to know, so how does it work? Do you see patients now with the COVID issue in person? Do you do work online? Do you do FaceTime? How is it that you generally see patients that we recommend that you see?
I work online under Psychology Today. It's encrypted, HIPAA compliant. And it turned out that people are much more comfortable in their own home, in their own setting, and being more relaxed, it's actually a bit easier to work.
That's great.
But let me add on to something you just said, which is that the advantage to me in working with you is that if a patient comes to me who's not referred by a physician, which I no longer do, but if they come to me from someone like yourself, I already know that I don't have to be concerned that what I'm hearing has a medical basis, that I don't have to differentiate. Well, is this manic depression? Is this, I know when they get to me, they've been medically cleared.
That's very important. And I really appreciate Dr. Siegel and what he's done for our patients, and I think it's a real advantage. If you want to see Dr. Siegel, there's a link on our site to his page. If you want to see us for hormone replacement before you see Dr. Siegel, which I think is the preferred method, as he said, then give us a call, and we will be glad to screen you for all these issues that are so important in going through the issues of hormone deficiencies and out of balance situations. So thank you very much, and hope you give us a call.